I'd like to introduce now Dr. Halkitis, the Dean and Professor of Biostatistics and Urban Global Public Health at the School of Public Health and the Director, Center for Health Identity, Behavior, and Prevention Studies, and a dear friend of ours, Perry.
Thank you, Vince, and thank you all for having us and being with us here tonight. Next slide, please. I think it's been an incredible year here at RBHS. An institution that's been on the move, on the rise, growing, moving rapidly, has been on steroids in some ways in the last year, doing even more than before. And I've been very happy to lead the School of Public Health in its effort to work with the state to really care for the well-being of the people and the populations of New Jersey. As a public health psychologist and an infectious disease epidemiologist, I always feel like I'm responsible to share my own belief that when we think about diseases like COVID, it's not enough just think about the virus. We have to think about the people and their behaviors. We have to think about the social conditions that perpetuate diseases in our country and in our world. And it should not be surprising to anyone that what we see around COVID-19 with regard to the disparities around race and around economic status is manifesting. We could have predicted this, but it points us again to the direction, which is the direction of the School of Public Health, which is one of social justice and of health equity. Next slide, please. We've thought about this idea at our school for a long time, this notion of targeting populations that are at risk, testing them, treating them, and tracing. And I'm going to talk a lot tonight about tracing and the contact tracing program we were able to develop and work with the New Jersey Department of Health on. Next slide, please. And so the World Health Organization issued this guidance on May 10th that indicated that contact tracing was an incredibly important strategy for all organizations, for all countries, for all states, and for all cities to undertake in the absence of really, really effective treatments and in the absence of a vaccine. And you will all remember we didn't have a vaccine, in the spring of last year. And so the way we could contain the disease was by identifying people who were exposed and seeing if they had exposed other people. Next slide, please. An idea that is not at all new and has been used for a very long time in public health with the Ebola crisis of 2014. And for those of us who were in the trenches like Dr. Strom and I around the HIV epidemic in the 1980s, something that was very common, how we would be able to identify infections and clusters of infections. In fact, I will say that this moment this moment in our history is a really important one for public health, because I think the way we started to think about social justice and health equity after the AIDS epidemic or during the AIDS epidemic in the 80s and 90s, it provided a reboot to how we thought about public health. And I think that the COVID-19 pandemic provides another opportunity to move things forward in a much more grand way, putting public health front and center in the way it should be. Next slide, please. And so we were able to develop a contact tracing program that was focused on really engaging with people, that developed a centralized system that was embedded in effective, clear, and collaborative communication. And the New Jersey Department of Health trusted our school to be able to develop the contact tracing educational program for the contact tracers of the people of New Jersey. And I think this was a stroke of brilliance on the part of the New Jersey Department of Health, because they chose to partner with the accredited School of Public Health within the state of New Jersey, an institution that really is committed to the people of New Jersey, to the populations of New Jersey, and people who really understand what New Jersey is all about. I say this as a proud New Jerseyan right now, right here from my home in Newark. Next slide, please. And so we were able to use these following principles to develop our program, which included the seamless integration of our systems with healthcare, the inclusion of public health expertise, and real coordination with the whole local health departments. Because as we have seen with the vaccination program in West Virginia, when we use local authority, when we use institutions that people trust, we're able to vaccinate at really effective rates. And this is the same notion we brought to the contact tracing program we developed. Next slide, please. So who's a contact? Just so I remind ourselves always, these are individuals who you are in contact with for 15 minutes or more within 6 feet of each other. Contact tracing is as important as it ever was. And so keeping our physical distance, even in the presence of vaccine, is important, because we don't know if people who are vaccinated cannot transmit the virus. Next slide, please. And so, as I said, we have to really bear in mind that even those of us who have 1 or 2 doses of vaccine, and soon we'll have a 1-dose vaccine, may still be able to transmit the virus to others. Studies are still being done. Stay tuned. That data will be available soon. Next slide, please. And so the principles for an effective contact tracing program are all of these: being open and transparent, being culturally relevant, maintaining, coordinating data management. And this is what we built into our program. Next slide, please. And so we wanted to build contact tracers who were drawn from our school, who knew public health, who spoke multiple languages, who were culturally and geographically aware, and who had great communication skills. Next slide, please. And we did this in coordination with the governor. And next slide, please. And we built a program that was based on 5 hours of basic contact tracing, 7 hours of in-depth case investigation and talking about COVID-19 in vulnerable communities, and really cultural humility and essential communication. And then, of course, we trained everybody on the platform for collecting the data. Next slide, please. Finally, developing these skills, we were able to not only connect people with testing, but also to connect them to social support services, because people have lives, and people are not just vessels in which the virus exists, but they have lives that they need to be supported in lots of different ways. Next slide, please. And so, in a very, very intelligent way also, we built a mini contact tracing program in our own institution, recognizing that the Department of Health had so much work to do that we could also offer our services with them. And so over the course of the last several months, we've been working with the New Jersey Department of Health and the local health departments to actually help them with the contact tracing of our own populations here at Rutgers. Next slide, please. The data indicate that contact tracing still has a way to go. We have a lot of work to do, but our efforts continue to exist in that regard. And finally, last but not least, thank you for, next slide. Thank you for having me. This is where you can contact me. It's been an honor to work with the state, an honor to work with my peers here. And now I'm going to turn it over to my very dear colleague,